It seems like Medicare intentionally makes things complicated just to make it so that we don't understand everything that we need to know when it comes time to sign up for Medicare, right? It just doesn't make sense to most people. So we need to get to the basics on what Medicare is about and how it works, because it's going to be our health care pretty much for the rest of our lives. So I'm going to go through that right now. And if you're new to Medicare, this is going to be a great video for you. Even if you're already in Medicare, you'll understand more when we're done with this video. And I'm Keith Armbrecht, founder of Medicare on Video. I help people across the country make the right Medicare choices. I can absolutely help you as well. Everything that I provide, there's no cost to you to use. So make sure you take advantage of all my videos. I have a book you can download, things that you're going to need to understand Medicare now and in the future, because it changes pretty regularly. So we want to make sure that we stay on top of things. I'm going to go through right now and pretty much explain Medicare to make it easy to understand exactly what we're going to need to know and when we're going to need to know it. The first thing to understand, what is Medicare? Medicare is the federal program designed to be health care, health insurance, generally for people age 65 and over. There's also Medicare for disability for under age 65 that runs through Social Security. If you've been on Social Security for more than 2 years on the disability, then you qualify for Medicare. But the majority is for over 65 health insurance going really for the rest of your life. So we want to make sure we get this right. And there are choices you have to make coming in that you don't want to mess up, because it can affect things dramatically down the road when it comes time. God forbid you have a significant illness or a significant medical condition where you're going to need to really navigate the system to make sure it works in your best interest. So that's kind of what Medicare is. Now, how does Medicare function? Medicare, and again, they make it complicated. They break it down into really 4 different parts. You have Part A, Part B, Part C, and Part D. And I don't know who dreamed up this scenario on how to break it down. And the way the government works with these different pieces is they fund them separately. So Medicare Part A is funded separately than Medicare Part B. So it can be a challenge for Congress to make sure they appropriate the right amount of dollars to keep everything functioning the way it's supposed to be. That's a whole different story. And there are going to be some challenges coming up in the not too distant future, because Medicare, same as Social Security, it just doesn't have a forever funding to it. So it will run out of money. They generally fix it at the last minute, but it'll come to pass in really not the too distant future. But right now we're going to go through the pieces of Medicare so that we understand how they work, because that's important to know when it comes time to use them. Medicare Part A is kind of the foundation, or at least the first part of Medicare, and it's really not that complicated, but it does come with some things that we need to understand. Medicare Part A pretty much covers inpatient hospital admission. And when I talk about inpatient hospital admission, it covers your room and board. So it covers the hospital room, the bed that you're in, the TV that you're watching, the food that you have in the hospital. It's pretty much room and board in the hospital, which can be a significant expense if you don't have insurance, for sure. So Medicare Part A does cover that. Medicare Part A has a pretty significant deductible when you're admitted into the hospital. Certainly something we need to know going in, that the out-of-pocket expense to Medicare Part A right now is $1,632. So if you're admitted into the hospital, you first have that deductible of $1,632 before Part A is going to start paying for your medical expenses. Now, the good news to that is generally if you're going to be on original Medicare with Part A and Part B, which I always recommend, you'll likely have a Medicare supplement plan. That supplement plan covers that Part A deductible. So there will literally be zero out of pocket if you have a Medicare supplement plan along with your Part A. Now, something else to understand with that deductible, it's not an annual deductible, it's a per occurrence deductible. So it could happen multiple times during the year. So you really would want that supplement plan to cover it each time if you go into the hospital more than once during the year. There are some other out-of-pocket expenses with Medicare Part A, primarily skilled nursing facility. If you're released from the hospital into a skilled nursing facility for rehab, then that also falls under Medicare Part A. And skilled nursing facility has a daily copay from 0 to 20 days. So the first day to the 20th day, there is no copay. But from 21 to 100, it's $204 per day. And that can add up quite quickly as you can do the math. But a supplement plan also covers that out-of-pocket expense. So it's good to know that going into the hospital, if you have a Medicare supplement plan, you're likely going to have literally zero out-of-pocket expense for the inpatient hospital admission portion of your Medicare. So that's certainly good to know. And that's the part that we need to understand going forward. And what Medicare Part A is going to cover is a semi-private room. So you're going to have a roommate if you're in the hospital, most likely. It also covers the meals, the medications, and the lab services that are done in the hospital. Now, what can be confusing in the hospital is stuff that's covered under Medicare Part B. So Medicare Part B covers doctor stuff. So even though you're inpatient in the hospital, doctor's visits, surgeries, procedures that are done in the hospital are going to be covered under your Medicare Part B. So this is where things just get confusing. And Medicare Part B has some out-of-pocket expenses to it. So not only on Part A do you have that big deductible when you're admitted into the hospital, Part B has a deductible also. It's smaller, and right now it's $240 a year. So it is an annual deductible on Medicare Part B, but Medicare Part B only pays 80%. So it's an 80-20 type insurance where Medicare pays 80%, you're responsible for 20%. So very important to understand that. That 20% could get out of control pretty quickly. Now again, if we have a supplement plan, a Medigap plan, it's going to cover that Part A deductible, no out-of-pocket expense. It's not going to cover the Part B deductible, but it will generally cover the 20%, which is the one that we really need to be concerned with. So pretty much with Medicare Original, A and B, and a Medicare Supplement plan, Plan G, Plan N, whichever may make the most sense in your area, it's really good coverage and it's really low out of pocket. So it's great to have, but it's stuff that we just need to understand. So that gives you a pretty good overview of Medicare Part A, just the one piece of Medicare that we need to understand for hospital admissions, things that happen really if something serious comes along and we're admitted into the hospital. So let's talk about Medicare Part B, which again, sometimes joins Medicare Part A if you're in the hospital, but Medicare Part B generally is for out of the hospital stuff, doctor's visits, outpatient surgery, specialist visits, pretty much anything that happens outside of the room and board side of the hospital is going to fall under Medicare Part B. And again, Medicare Part B has an annual deductible of $240 a year, not a big deductible, but something we need to know so that we don't get surprised with a bill the first time we go to the doctor each year, and it resets every January. And then Medicare Part B shifts to 80-20. So they're going to pay 80%, you're going to pay 20%. Again, if you have a Medicare supplement plan, it's going to cover the majority of all of that. It's not going to cover the $240 deductible, but it will generally cover the 20% coinsurance as you go along, which is certainly the big piece of Medicare Part B. So just about anything outside of the hospital is going to be covered under the Medicare Part B, including preventative services, home health care, durable medical equipment. If you needed a wheelchair or crutches or something like that, is going to be covered under Medicare Part B. Also mental health services, if you need counseling or whatever it may be in that area, is covered under Medicare Part B. Pretty much all the kind of regular stuff is covered under Medicare Part B. So just understand, every year you're going to pay the first $240. It generally goes up some every year, that deductible. It's $10 or $20, usually less than $20, hopefully, is the increase in deductible each year, but it's going to be an out-of-pocket expense that we're going to have to address when it comes time every year. I do have another video that addresses the costs of Medicare, and it breaks it down pretty easy to understand, so I'll put the link below this video. Make sure you take a look at the real cost of Medicare, and I go over every piece of it so you understand exactly your out-of-pocket expenses when it comes time to use things and going forward. Makes a lot of sense to understand. Now let's talk about Medicare Part C. And this one it doesn't make a lot of sense to me. It is Medicare Advantage, which certainly is an option to have coming into Medicare, but it's really not Medicare. So why they lump it in as Medicare Part C, why it's called Medicare Advantage, it just doesn't make a lot of sense. So Medicare Advantage, when you first come into Medicare, you have a major decision to make. You're either going to stay on original Medicare, Part A and Part B, and likely have a Medicare supplement plan like we've been talking with the expenses on Medicare Part A and Part B, or you can choose to go into a Medicare Advantage plan. And there's a lot of talk right now about how Medicare Advantage markets themselves and there's misleading information, but it is an option. And right now it's about 50-50. About half the people are on Medicare Advantage, about half the people are on Medicare Supplement with original Medicare. So it's a real decision. Certainly one, if you've seen any of my videos, I just would not choose to go into a Medicare Advantage plan. Original Medicare is much too good to choose to leave and go into a Medicare Advantage plan. What a Medicare Advantage plan is, it's a privately run health plan that's run by an independent insurance company. So it's a for-profit scenario for your health insurance. So the last thing that I want is to have a for-profit for somebody else making decisions on what's going to be paid for on my health care. And it can be a real issue if you have a significant medical condition, especially something like cancer. It can be very problematic. But again, you need to understand your choices because it certainly is a choice. I choose only to solicit Medicare supplement plans with original Medicare. I do not do Medicare Advantage. So if you're going to stay with original Medicare, I certainly would appreciate if you allow me to help you, because we'll find the best value for you in your zip code with a Medicare supplement plan. We want to keep it as low out of pocket as we can, but still, the fantastic coverage is what is our main priority. So Medicare Advantage runs generally like a managed care plan. So you may have had something very similar at work, and any large corporation, usually your first choice or your main choice is the HMO plan, the Health Maintenance Organization. And if you've had experience with that, you would understand that generally it requires things like referrals to go from a primary to a specialist. It requires pre-authorization. If your doctor recommends something or more says you need something, they first have to get it pre-authorized by the insurance company in order for it to get paid for. And that is just something that I would not want to have going down the road as we get older with our major medical care, is to have to ask for permission. If my doctor says I need something, then we have to go ask for permission to make sure that it's going to be covered. So there's main reasons, networks of doctors, networks of hospitals, networks that show doctors and hospitals that are no longer there, just a whole list of things that can go sideways with Medicare Advantage. And, it's kind of been promoted by Medicare. The idea was that it would save money for the government and provide better care, but that just has not been the case, where it's actually provided less care and costs more. So it actually costs the government more to send somebody to Medicare Advantage than it does to keep them on original Medicare. So in my opinion, very good idea to stay with original Medicare with A and B if you possibly can. It's important to understand, and a lot of people get this confused with Medicare Part B, there's a premium. So you're going to have a monthly premium for your Medicare Part B, and it is going to be paid regardless of whether you stay with original Medicare or you go with a Medicare Advantage plan. A lot of people think if they go Medicare Advantage, they aren't going to have to pay that Part B premium. That Part B premium right now runs about $170 a month. So it's going to be there no matter which avenue you choose. So very important to understand, and I'm not going to get deep into Medicare Advantage right now. I do have a video that I would encourage you to watch. It's got about 2 million views on why I would never choose Medicare Advantage personally. And again, it's one of my highest viewed videos. So just take a look. I'll put the link in the description below this one as well. It's just, you need to understand exactly what your choice is going to be. So the other side of the coverage would be Medicare Supplement plan. So versus a Medicare Advantage plan. So Medicare Supplement or Medigap, it runs with original Medicare. So you have A and B. You have those out-of-pocket expenses that we talked about. Part A has a big deductible. B has a little deductible. B has 20% coinsurance. You would have a Medicare Supplement plan that covers the majority of those out-of-pocket costs. And the best thing about Medicare Supplement plans, number one, they are standardized, which means they have made them so the benefits are exactly the same no matter which insurance company you choose. So a Plan G is a Plan G. It doesn't matter insurance company A, B, C, or D. They have the exact same benefit, which makes it really easy to compare and make sure we get the best value. I don't know why they haven't done that with Medicare Advantage. Medicare Advantage is completely different from one company to another company, and you cannot compare, and you will not know the differences until you need them. So with a Medicare Supplement plan, it's black and white, and it just makes it so easy. There's no networks. You can go to any hospital, any doctor, anywhere in the country that accepts Medicare without asking permission. So again, that's something I want. If I have a really rare case of whatever it may be, and I need to go to a doctor in Chicago, or I need to go to a doctor in the next city, I want to be able to do that. And with a supplement plan, you don't have to ask permission. You simply make an appointment and you go. With a Medicare Advantage plan, you are restricted generally to the network, and some will tell you they have out-of-network benefits, but you would quickly find out the cost to go out-of-network is just prohibitive, and it's much too expensive to use. So you would be restricted generally to the in-network doctors and hospitals that are listed on your Medicare Advantage plan. Some are very restrictive, so you got to be super careful in that area. But with a Medicare Supplement plan, just the ease of use, the flexibility, and the way they work, number one, there's no pre-authorization. If your doctor says you need something and you agree, you do it. And if it's medically necessary, Medicare covers it. And the way a supplement works is if Medicare covers it, the supplement has to cover it. So there's absolutely no decision-making whatsoever on the part of the Medicare supplement plan on whether or not something is covered. If Medicare covers it, they have to cover it. And whichever doctor you use, if they accept Medicare, they have to accept the supplement. Doesn't matter what company it is. So they can't say, oh, we don't accept this company or that company. With a Medicare supplement plan, a doctor bills Medicare. That's all they do. And Medicare handles the claim and then takes care of the supplement payment to Medicare. So it just makes it super easy for you and your doctor. And that's another thing that I want. I want my doctor to be happy with what I have. I don't want him to be unhappy when I walk through the door because it's going to take him all sorts of things to get paid. I want my doctor to be happy as well. So with original Medicare, that's exactly how it works. It is by far the best option in the way it functions, the way it works with you, with your doctor's office. It just makes life easy. And that is exactly what we're going to want with our health insurance going forward. Medicare Advantage, completely different scenario. Makes things complicated, makes things hard, makes things difficult for you and your doctor, which again is not something that I would look for in my healthcare, as I'm going to need it more and more down the road. Now, I also have a video on the best Medicare supplement plan, and it's not that complicated. Like I say, they're standardized, but there are choices: Plan G, Plan N, possibly a GHD. You need to understand the differences so we can find the best value on what we're looking to do. So I'll put the link below to that video as well. Best Medicare supplement plan just gives you a pretty clear idea on what the differences are between G and N and GHD and things like that. So make sure you take a look at that. Now, our last piece of Medicare might be the most complicated. It's Medicare Part D, and this is Medicare drug plans. And Medicare drug plans are complicated. And, I'm not sure that this is going to get fixed anytime soon, but if you've had experience with your group plan at work, it's kind of similar, where you have drug coverage, you have a deductible, then you have tier levels: tier 1, tier 2, tier 3. It depends on what tier your drug is on that you need on how it's going to be covered. And this can be difficult and confusing as well. And drug plans are not standardized, so they're completely different from one company to another company. So it makes it a little harder to find exactly what's right. The difference between having a drug plan with original Medicare and a drug plan with a Medicare Advantage plan: Medicare Advantage generally bundles the drug plan up with their coverage. So if you're going to choose the Medicare Advantage plan, you don't really have a choice on the drug plan. You're going to have to use the drug plan that they have within their Medicare Advantage plan. That can be problematic too, because when you bundle things, if you have a problem with one thing, then you're generally going to have a problem with everything. So it's difficult to find the right combination of the right healthcare and then also have the right drug plan that goes along with it. So make sure you're very careful if you're looking at Medicare Advantage plans, not only at the benefit part of the health part of it, but the drug plan part as well, because it's going to play a big role as you go down the road one way or another. With original Medicare, you find a separate drug plan. So a drug plan, and there are going to be some changes coming up to drug plans, so it's kind of hard to predict what the future is going to be. But the best way to get the right drug plan as a standalone with original Medicare is through Medicare. And they actually have a really good site. It's called Drug Plan Finder. And I have a video that walks you right through it. And the reason it's the best way to do it is because you don't want to have somebody selling you a drug plan that might not be the right drug plan. Because drug plans, there are so many of them, there's no way that an insurance broker is going to have access to every single drug plan. So it may be one that they don't have that is the best one for you. And when you use the Drug Plan Finder with Medicare, you put in your medications, you put in your pharmacy, and it brings up the best drug plan with overall out-of-pocket costs, including deductible, including premium. So it might not be the lowest premium plan that's the right plan, because the drugs might cost more. So if you combine it all together, it gives you an annual out-of-pocket expense, which shows you which would be the best value in a drug plan. So take a look at the video. I'll put the link below in the description, how to find a Medicare drug plan. Just makes it easy to get it right. And that's exactly what we want to do. So that gives you a pretty good overview on Medicare. It doesn't give you all the overview, but it gives you a pretty good overview to help understand exactly what the main pieces are and kind of how it functions. So it's certainly important to get it right. And that's what we do, is we help to get it right. I've helped thousands of people across the country. I'm licensed in all 50 states. We can make it as easy as possible. If you're going to stay with original Medicare and a Medicare supplement plan, then we will make it simple so that we get it right in the first time. And that's certainly the important part to do. Make sure you download my book. You'll find that very helpful. Now, before you go, take a second and take a look at this video. There are some big changes coming, mostly to Medicare Advantage at the end of the year. So you want to make sure that you understand, if you're going to go that route, that you make sure that you understand what these changes are going to be, because this is the first time there's going to be a lot of disruption coming with Medicare Advantage. So take a look at this video, and I hope you found this helpful. Have a fantastic day.